Welcome to Alliance Technology's 2012 Tech Jam. I want to thank everybody for taking time out of their busy day, coming down here and enjoying us. I wish the weather would be a little bit nicer so we could kind of walk around outside and stuff, but unfortunately, looks like we get a little bit of rain. But that won't bother us inside. We have a lot of fun, exciting stuff going on today, and I hope that you guys will agree. For those of you who are not familiar with Alliance Technologies, we are part of a family of companies that also includes Iowa Network Services and Alliance Connect. And between the three members of this family of companies, we can provide you the voice, the communication and data links, and the technology to pretty much do whatever you need to accomplish, covering the states, not only around Iowa, but we have also opened up a branch in Minneapolis. So what we are doing today, oops, went the wrong way. One of the things that we do here at Alliance Technologies is we want to be a trusted advisor for our customers. And we take this very, very seriously. We support that being a trusted advisor to our clients by our 5 guiding principles, which you see up here. And it's that trusted advisory is the reason we brought you TechJam. We started this off last year. We had about 15 breakout sessions and 100 members, or 100 attendees. And we got some really positive feedback about some things that we could do to improve that. So this year, for 2012, we've doubled the size. We've got 30 breakout sessions. We've had over 250 people register for the event. So we're hoping that it's going to be equally successful as what it was last year, and we'll kind of see where things go for 2013. So to kind of go briefly over the summary today, the agenda, what we're going to have is if everybody will reach into the little goodie bag that they had when they registered and pull out the schedule. You're going to see that we're going to have a keynote. We're a few minutes late here this morning, but we're going to do a keynote between 9 and 9:40. Then we're going to kick off with a couple different sessions. We've got lunch from noon to 1. We're going to do sessions between 1 and 2, have a mid-afternoon break, sessions again between 2 and 4, then we're going to kick back and have a happy hour for a couple hours. But on this agenda that you've got, there's a couple things I need to talk to you about. First of all, for those of us who want to do a little bit of work in between sessions, there is a wireless network set up for us here. It's the Alliance Network, and the password to hit the Alliance Network is techJam 2000, or excuse me, Tech 2012. So it says Tech or just Tech on there, so it's Tech 2012. And then you can log into that whenever you're out and about, or even during sessions if you need to communicate back. Now, the sessions that we have set up for you today, please take TechJam and make it your own. It's an educational experience, and that's purely what we brought this together for you today. During the sessions, hopefully we've been able to cover enough of interesting topics that it makes sense for you to hit one in each session time slot. But in between times, please go out and talk with the vendors, talk to the speakers, catch an Alliance Technology employee with a black shirt on, and ask your questions. Ask questions during your sessions. I mean, these things are built and constructed to be a two-way conversation, so everybody can kind of learn what's going on. Because as part of being a trusted advisor, we need to educate the people around not only the technologies that you're using today and have had installed for years, but new technologies that are coming out. And what are some of the things that maybe you're not going to look at implementing the next year or so, but have an interest in. And hopefully we'll be able to bring some of that together for you today. Along with that, during lunch is also a good time to stop by the vendors, because we've given you box lunches. And I was going to say, take a box lunch, go outside, sit out and get some fresh air and stretch your legs, but it looks like from what I saw on the radar, we're still going to be underneath the rain for a while, so let's not do that unless you want to get wet. But we're going to have lunch, it will be in here, and then the happy hour will be in here. But if you don't want to sit at a round table, you can go out, pick up a couch, stroll a little bit, again, talk to the vendors, interact and network. That's what the whole day is been structured around. Additionally, when the happy hour, we're going to have a prize drawing. And if you've seen the prize table out there, I think we've got like some Xbox Connects. We've got some Kindle Fires. I think we have an iPad, a backpack, and a few other things. The way that you will be qualified for one of those prizes is to fill out your survey card and turn it in at the end of the day at the happy hour, okay? In addition to that, we've had several people that have had requests about the presentations, like, oh, I want to go to this session at 10 o'clock, but I also want to go to the other session, and I can't do them both. If there's a session that you want to get the PowerPoint to, write that on the back of your comment card when you turn that in, and then we will individually mail that off to you or send it off to you in an email, okay? And that's how you'll get that information back. At the happy hour tonight, you don't have to be present to win. It would be a lot more fun if you were. We'll draw those drawings, and basically I think it's going to run a couple hours. Jason, that's about it. What else do we have to cover this morning? Oh, keep losing my clicker. The session rooms that you'll see on your agendas, take note that though it's session 1, it could be in rooms 3 through 8. So the session time is what the session number is, but then pay attention to the room that it's in. Also, what we tried to do is give you some indication on whether or not it is a technical or a non-technical session. So if you want to take a look at that as well. So the last thing I need to do then this morning is introduce our keynote speaker, which I'm sure everybody has been here waiting to see. Our keynote speaker this morning is Jim Cuddy. And Jim has come to us from Dell's EMR division. We've been working with Jim for quite a while, and I keep hitting the clicker. Now I really mess up. Hold on here. Everybody like my bale of hay I have sitting out there? There we go. I'm going to set this down. Jim has been working with Dell since 2007. And currently his role with Dell is a physician sales executive for them. And what he does is he covers a 13-state region in northern Mid-America and the Great Lakes states for the EMR division of Dell. Now, what he does for that is he works with not only the Dell partners and other IT companies, but with healthcare providers throughout his region, helping to implement some of the new complexities around the EMR programs that are out there today. So with his background, his leadership, and his knowledge and experience, he's helped everybody bring to a new level of what they can do in healthcare and IT. He's done such a successful job at that is that he has been awarded in the Sales Excellent Elite program within Dell. That means he's in the top 4% of the Dell sales employees nationwide or worldwide, I guess it is, isn't it, Jim? So I think you'll see today, with his background as a communication studies degree from the University of San Diego, is that correct? He's very entertaining and educating, but I'd like to welcome Jim Cuddy.
I got a lot to live up to after that. I'm really excited to be here, and thanks for coming out. I think you're having a great day here at techJam. And you know, I am excited because for the first time in 24 years since I got out of the University of San Diego, I had to use my college major of speech communications. So pretty excited to be doing that. So how do I get to my presentation, my friend? How do I do that?
You don't have to belt the hay.
All right. So I just wanted to get to know you all a little bit better. So we'll start over here. No, I'm kidding. But just by a show of hands, who here is in IT management? Okay. And more specifically, who's in IT management of healthcare? All right. Don't be shy. And any physicians? Any doctors here today? No? Good. We can talk about them. Really what I'll be talking about more is going to be centralized around healthcare and IT. But the one thing that we all share in common is that we're all patients, either in the past, right now, or in the future we will be. So what we're going to talk about today will impact that. And Nick had brought up the first row. I'm not a spitter, so that's not a splash zone, so you guys are safe. But under one of those chairs is some money. So if you're sitting there, you might want to check. All right, so let's begin here. So basically, you know, I'm 45 years old, so I kind of grew up watching Little House on the Prairie, and my really first recollection of old school medicine was Doc Baker, you know, in his wagon going around to the different homes with his little black bag. Obviously, we've come a long, long way since those days. And during this time of the evolution of our healthcare, what has also come is a lot of data and a lot of information, which is a good thing because obviously we're in the United States, it's the best healthcare system, but it has its limitations. The limitations really are about where that data is stored. And typically, it's on paper format, right? A lot of hospitals are on EMR systems, and before I get going, I'm going to mention the term EMR a lot. That stands for electronic medical records. So just so we have that. So, what we need to do is really figure out a way of how to get that data out of there and into the masses of healthcare. So the first start of this is to take this data that's disparate. It's sitting in those, we've all been to the physician's office and they've got those big racks of manila folders that have basically our healthcare life in it with the rainbow color tabs on there. And when I first got started in my role, a gentleman was doing a talk similar to this, and he made a statement that's really stuck with me. He said that in this country today, we can actually track a Federal Express package better than we can track our own medical history, which is kind of ridiculous if you think about it. So the first step in getting to that point is we need to take this information and digitize it. It needs to come out of paper format, come out of those silos, those disparate systems that are out there, and into a digital format. The second, once we have it there, we need to get it out to the healthcare community. How are we going to do that? The cloud. And we'll get into more of the cloud later on, but that's the easiest, most effective, and secure way to do that. And lastly, we need to put some structure around that, because what we don't need is the healthcare professionals worrying about how to manage the data. They just need to use the data to help make us better and drive healthcare to where it needs to be. Now on this slide, this is back in 2008 when the administration changed. One of the things that came out was ARRA, American Recovery and Reinvestment Act. And in that was part of the TARP bill, was there's $32 billion that the federal government set aside for hospitals and for physicians who adopt EMR, okay? And so right now, that is the stage that we're in right now. So the adoption rate, there's still about, they estimate anywhere from 800,000 to 1 million physicians that have yet to adopt. So it's still a pretty green field out there. But step one in this whole process is getting the paper out of the system, save a tree, adopt an EMR, basically, and, get it into a digital format. Phase two, which will, encompass the next 3 or 4 years, is now building these HIEs, these health information exchanges, so we can take this disparate data, put it in one repository, if you will, and healthcare, systems can share in this data, again, to drive healthcare to the next level. And lastly, phase three, this is where we can now start taking that data and being proactive with it. So I live in Austin, Texas, and one of the prime examples of, if you've ever been to Austin, right after Christmas time begins cedar season. Cedar trees begin to blow and cedar fever, and I feel bad for people who have allergies because it's a mess. But when we get to this state right here into this is where we're going to be more proactive, like sending out email blasts to people. Hey, cedar season's coming. Maybe it's time to come in and get a shot. Flu season, things like that. So taking the data and starting being proactive with it. All right. So this slide is really talking to how do we get from phase three, and this is the steps it's going to take. Again, we got to move from the episodic care, and that's just where, most of us. Now I'm a guy, so I rarely go to the doctor, okay, until my wife tells me it's time to go. So, but we need to get to the point where instead of just going to the doctor one time, we need to get to where they're starting to build wellness programs for us. Now I know some companies offer that, which is fantastic, but we need to get it more on the physician level. This point right here is between the doctors and the hospitals, because a lot of hospitals and doctors share patients. Now, if anyone can relate to this, for instance, maybe you've broken an arm or blew out a knee or something like that, and you had to go get x-rays. And then you had to take your x-rays and go over to the specialist, the orthopod, and show them your x-rays. And then take all this. So you're walking around with all this data. which is ridiculous, because once we get it into a system, you should be able to say, you show up, Mr. Jones, okay, we have all your data right there. That's where we're trying to get to. This is the big one right here. The streamlined admin costs, that is between the doctor and the insurance companies. Because one of the things right now that's bogging down healthcare is around billing. So if the physician doesn't code it correctly, it doesn't get paid correctly. And it can go back and forth. And I'm sure all of us have a nightmare story about haggling with your insurance company because it didn't pay something correctly. All that creates cost, cost, and cost. So if we can take these things, streamline them, take all that complexity out of it, the goal would be then our healthcare costs should come back down to where they should be. Right here, this is between the physicians, the payers, and the pharmaceutical companies. Once they have the ability to share this data, they can make better drugs, again, do these wellness programs, be more proactive, but we need to get the data in their hands to do so. And lastly, that's between us and our physician. So again, it's time to go to the doctor so they can learn about us and learn to be, once they have this data and they can just focus on healthcare instead of running a practice, worrying about systems and things like that, they can design more personal medicine programs for us, wellness programs and things like that. The one nice thing I like about this slide is that it looks like an archer's target, and right in the middle is the EMR, EHR. So again, I'm going to harp on that because it all begins with digitizing the information. Now the nice thing is that once we can get these healthcare communities connected, now healthcare is not going to have any boundaries. And I know a lot of you in the IT space, for whether it be healthcare or not, know that everything's going mobile. Consumerization is starting to come into play and things like that. We need to get this data to the clinicians, to the ones that are driving healthcare, when they need it and where they need it. The trick in doing so is to make sure that we don't interrupt care, but we find ways to enhance it. All right. This is more of my PhD slide. This is really talking about molecular medicine. And what that is that over these past 20 or 30 years, with the advent of technology, outside of what we're talking about today, they're studying, not just the symptoms of disease, but what causes the disease themselves. And this is able to then, get to the drug companies involved to make the better drugs to ward off that disease. But what this is going to do, it's going to generate massive amounts of storage and use issues. So that's going to be coming into play. So infrastructure is going to play a big role in this. And, excuse me, that's one of the other solutions we're working on as well that we'll cover. All right, now we're at the cloud. So I know I'm going to assume that everyone's heard of the cloud and we have some sort of definition of what the cloud is. It's not this big ominous thing or anything like that. It could very well be the place that my kid loses his shoes in all the time too. But the nice thing about it is the cloud is right here. It's going to take all this and put it into this space so these folks up here can concentrate on what they do best. All right? It's going to take the data, it's going to take those images, it's going to store it, securitize it, and have it ready so when these folks need it, they don't have to run around their office looking for it. They can now push a button. They don't have to pull it out of some sort of storage cabinet or file. It's going to be right there at their fingertips. And this is, a big deal. And these things inside here, very big. If you're in healthcare, you've heard of HIPAA. And HIPAA is basically the watchdog. And now that ERA is writing checks for EMR adoption, HIPAA is even that much more critical, that things are secure, that all of our data is privatized, So the nice thing is I can say is that Dell, we are also in the hosting business of EMR. And for 13 years, we've never had a breach. And I'm sure you've seen those things on TV. Just down in Baylor a couple of weeks ago, someone stole 80 iPads with, unfortunately, patient data on it. So this cloud really comes into play into helping all this get to these folks right here. Now this is more from a Dell perspective. And Dell, we believe that there's 4 pillars that are going to help us and the caregivers help us get to the place where they need to be. Number one is we're going to have to empower the caregivers. They need the right technology at the right time to give the care that we need as patients. And to do this, first step, unlocking that information, taking it out of paper form and digitizing it. So right here in Least Innovation, anyone that's in the IT space probably heard these numbers that, you know, about 70% of your resources are committed to just keeping the lights on, maintaining what you already have, which leaves, you know, less than 30% at sometimes for innovation. We need to flip that. We need to do it where we need to find more of those end-to-end solutions that's going to take that 70% and turn into 30 and the 30 into 70, so we can find more innovative ways to drive technology in this info-driven healthcare world that we're in right now. Lastly, we need help with the infrastructure. It needs to be scalable, easy to use, and adaptable. This is just a little funny cartoon. I've had the privilege of going into over 400 physician practices to assess the health of their practice. And this is what a lot of doctors tell me that their knowledge of IT is. So, and frankly, I believe them after seeing what some of their offices look like. So one of the oldest solution that we have at Dell, and Dell's now moving towards, if you've seen our ads lately, it's not about the pink laptop anymore, it's more about solutions. And this is our first end-to-end solution that we created about 5 years ago. And obviously it's EMR, which is near and dear to my heart, and it's both acute and ambulatory. Acute has to do with anything that's inside the hospital. So when you go in for an inpatient, you'll be on an acute type of EMR system. Ambulatory has to do with their own physicians and the physicians in general. So what we can do as a company, and when I say we, I also mean Alliance Technologies. Alliance Technology is one of our first EMR solution partners in the channel that we have, and they can offer the same end-to-end solution that we have. And when I mean this is that they can go in, assess the practice. If you want to host an EMR, and right now we currently host Allscripts, eClinicalWorks, Greenway, and NextGen, and we have been for the last 13 years. Alliance can also help you with that. So if something like this, you know, that you've heard about or looking into, you know, please reach out to your Alliance representative, because we can definitely put something in place to help you get to your goals. And these are just all some of the capabilities that we have around that. And it's taken a long time. You know, one of our upper leaders actually said to me, he goes, well, you know, I think we're a couple years, 2 years too early to the mark. And I said, well, it's good because we messed it up so many times, we finally got it right. So we really have a fantastic solution end-to-end around all this right now. This next solution is called mobile clinical computing, and this is something that you would find in a hospital setting or a very large practice. In sitting with our customers, one of the things that we heard repeatedly was that when you have an EMR, it's the logging in and logging out. And I don't know about you, but as I get older, keeping passwords straight in my head, it's becoming ridiculous, because it seems like everything has a password on it these days. This takes that out of the way. Most people have some sort of badge at their office or fingerprint reader or what have you. They can swipe in, they get on their session. Whenever they leave, the nurse, the doc, whoever, they swipe out, screen goes blank, and wherever they show up again, that same screen is right there. So it cuts down big time on time. They save hours in the day, you know, as a hospital. You can think about that just by not logging in, logging out. And it's around security, because the last thing you need is someone forgets to log off. Your data sitting there for anybody to walk by and see it. Can't have that. HIPAA says no. And one of the last solutions I'll talk about is our unified clinical archiving. And what this is, it's around PACS and radiology. You know, anytime you get an X-ray, like we talked about earlier, even if it's, most X-rays are only viewed once, but they have to be kept up for up to 7 to 10 years, depending on the state that you're in. They're bigger than JPEG, so they take up a lot of space. And again, what this solution does, it's using the cloud, it's taking that away from the hospitals and things like that, so they can use that space for something else. So right now, we're hosting actually the images over 5 billion at this point, and I think the studies is over 70 million. So again, it's just one of those other solutions that we're trying to make it easier on the healthcare communities by taking that off their shoulders, letting us do it, and so they can use those resources in other places. The last thing I'll talk about is, this is, and I wrote this down because I want to make sure I got it right. We're in last November with TGen. TGen stands for the Transitional Genomics Research Institute, and it's around pediatric cancer. Dell is very big at giving back. We feel that obviously too much is given, much is required, and we really live that's part of our DNA. And so what we've done is with TGen, we have built a cloud. I'm going to put these all in. We're also working, the NMTRC stands for, these are big words, sorry, Neuroblastoma and Meduloblastoma Transitional Research Consortium. This group is doing all they can to find a cure for pediatric cancer. And so what Dell is doing, it's a multi-year, multi-million-dollar program that we're doing, is we're basically giving a cloud-based system supporting right now 11 hospitals here in the US. And as it expands globally, we will continue to add to that infrastructure because, Michael's, one of his biggest things is in healthcare and is, trying to help the world as a whole do what we need to do. So I kind of flew through this thing, but that's really where things are at. I know it was more healthcare centric, but at the end of the day, it does affect all of us because we all have health insurance we have to pay. And I think we all agree it's kind of crazy how high it is right now. But hopefully our goal and the goal of the partners that I have, one of Dell's biggest goals in healthcare, those 4 pillars, we want to drive technology to the point where we're getting those costs that don't need to be there out because it's going to save us all money, it's going to save all the companies money, and it's going to have us have better healthcare disposal. So if there's any questions, I'd be happy to answer them.